There are some self-help techniques that work for anxiety. And what are those? Because boy, if we are armed with tools and strategies, we can often kind of cut the anxiety off before it gets full blown. So if anxiety is causing physical symptoms and you are uncomfortable and you know the root cause is anxiety, then distract yourself or take a mental break. That can be really helpful. Just do something different. Do the laundry, put together a jigsaw puzzle, water the plants, change where you are physically. Just totally take yourself out of the current situation mentally and or physically. Because often when you move on to another activity and take your mind off your symptoms, you'll start to feel better. Try different activities to figure out what works for you, what takes your mind to a calm place. Another big area we're growing in knowledge about is nutrition. We already know that what we eat affects our bodies, and a growing body of research suggests that our food choices can also affect our minds. Uma Nadeau, a nutritional psychiatrist at Massachusetts General Hospital, says that an anti-anxiety diet can be a very powerful tool in improving our mental well-being, and it's one of the ways we can help calm our own mind. In her book, Calm Your Mind with Food, A Revolutionary Guide to Controlling Your Anxiety, she explores the gut-brain connection and how the gut and the brain are in constant conversation about appetite, digestion, and even our mood. Scientists have shown this strong connection, and some even now refer to the gut as the second brain. The vagus nerve, which starts in the brain and extends through the abdomen and intestines, helps explain why we often experience feelings of anxiety in the stomach and gut. I mean, how often have you heard the phrase, I just have a gut feeling? Or when you feel anxious and your stomach just feels queasy. Another link between the brain and the gut is serotonin, an important neurotransmitter that affects mood and is mostly produced in the intestines. More recently, the microbes, which live in our gut, have become a focal point for researchers studying the link between mental health and the microbiome. An imbalance in our gut microbes has been associated with anxiety and depression. And the foods we eat can have a profound effect on our microbiome. And Nadeau believes that by choosing the right foods and reducing the detrimental ones, we can improve our mental health. How good is that? She says that eating specific foods to give your mental health a boost and calm your mind is a complementary strategy to combat anxiety. So, what are the foods that make up this diet? Here are 7 of them that help ease anxiety. The first I like, extra dark chocolate. She recommends eating a couple of small squares of extra dark chocolate every other day. It is rich in iron and polyphenols, which are plant compounds linked to several mental health benefits. Studies have found an association between iron deficiency and anxiety, while cacao has been shown to boost mood. If you pair it with citrus fruit, such as orange slices, you will get an extra boost because citrus fruits have vitamin C, which has been shown to help with iron absorption. Look for natural chocolate that is 75% cacao or more. Then the next one is leafy greens. Leafy greens are packed with fiber, folate, iron, and other micronutrients, as well as lutein, an antioxidant which research has shown to reduce depression in mice. Broccoli is another big one. Broccoli and other cruciferous vegetables, including cauliflower, Brussels sprouts, and cabbage, are an essential part of this diet, and they are rich in sulforaphane, which is a powerful phytochemical that helps reduce inflammation in the gut. Also, avocados. There is some research indicating that magnesium can improve anxiety symptoms, and low intake of magnesium has been linked to depression. Avocados are rich in fiber, potassium, vitamin E, and magnesium. And she recommends eating a quarter or half piece of a small avocado a few times a week. That can be in the form of guacamole or sliced avocado. Also consider green tea, because drinking green tea during the day can provide a calming effect, because it contains 2 antioxidants that have been shown to reduce stress-related symptoms such as anxiety and depression. Also, natural sources of omega-3s are really helpful. Fatty fish, chia seeds, flax seeds, and walnuts are great sources of omega-3s. For those who eat fish, she recommends incorporating salmon into their diet. For those who follow a plant-based diet, she suggests eating a quarter of a cup of seeds daily. Also, go for beans and lentils. They are a great source of fiber, and fiber is hugely important for gut health. There are also certain foods and drinks to stay away from because they're anxiety provoking, and these include sugary drinks and foods, caffeine, alcohol, processed foods such as chips, cookies, frozen foods, and ready-made meals, and foods high in trans fats and excessive saturated fats such as fried foods, red meat, full-fat dairy, butter, and baked goods. That one kind of hits a little hard for me. Then beyond your nutrition and making sure you're taking care of your physical health is to relax your body or work it. To relieve stress, try some deep breathing or relaxation exercises. There are lots of online resources and smartphone apps that can help guide you through relaxation techniques. Physical activity can also help you relieve tension. Try to take a daily walk or engage in another physical activity. And when you're anxious, reassure yourself, talk yourself through it. If your symptoms are being caused by anxiety, you've gotten checked out and you've learned that there's no evidence of a physical condition causing your symptoms, then reassure yourself that what you are experiencing is not harmful or fatal, and that the symptoms will pass when the anxiety lessens. Well, what are the professional treatments for anxiety that have good evidence to show their effectiveness? Talk therapy can be very helpful, and especially a form of talk therapy called cognitive behavioral therapy. It often helps reduce anxiety. It involves working with a therapist to change thought patterns and behaviors. If you're having trouble sticking with a prescribed treatment, or if you're having trouble changing your dietary habits to reduce your anxiety, then health coaching is an effective way to get the support, techniques, and accountability to successfully change your health habits and thought patterns so that you can better manage your anxiety. High levels of continuing anxiety often need medical treatment along with talk therapy and self-care for symptoms to get better. I always think about when you combine therapies, it's especially for depression and anxiety, it's kind of like 1 + 1 = 3 in terms of the amount of benefit that you get. So if your anxiety is not improving with your self-care techniques, meet with your medical provider or mental health provider to discuss what options you have. So we've been going through a lot today. There's a lot of information here, but there's another thing that I really want to share with you that I find very exciting. And there's more and more research being done on caregiver mental and physical health and the factors that correlate with the quality of caregiver health and how to fashion interventions that will actually be helpful in improving caregiver quality of life and quality health. I find this really encouraging. And to give you an example of how research is opening the doors to a fuller understanding of how to intervene to improve caregiver health, I want to share with you the findings of a study published in the Annals of Oncology journal back in 2016. The researchers sought to describe rates of depression and anxiety in family caregivers of patients with incurable cancer, and to identify factors associated with these symptoms to determine those at greatest risk for psychological distress while they're caregiving. They found high levels of depression and anxiety in patients with incurable cancer and in their family caregivers. But nearly half of the caregivers in their study reported high rates of anxiety symptoms, a significantly larger proportion than was found in the patients themselves. Patients in the study were newly diagnosed with incurable cancer, which may help explain why family caregivers reported such high anxiety rates. Soon after diagnosis, family and friends are thrust into their new caregiver role with little preparation, and this lack of preparation may result in low confidence in their caregiving ability and anxiety related to the uncertain future demands of the caregiving role and what changes they're going to see in their own life and in the life of their family member. So they learned that interventions targeting caregiver anxiety earlier in the patient's disease course may prevent ongoing caregiving burden and enhance their ability to provide assistance to their loved one as well as to protect their own health. And this study also showed an interesting relationship between the patient's understanding of their own prognosis and the severity of their illness and the fact that it was considered incurable. There was a relationship between their understanding of that and their caregiver's level of depression. When a patient with terminal cancer reported that their primary goal of their current cancer treatment was to, quote, cure my cancer, unquote, that was significantly associated with worse caregiver depression. This suggested that overly optimistic patient perceptions of their own prognosis may contribute to their caregiver's depression. And additionally, nearly 1/3 of patients chose this treatment goal, which seemed to indicate that there were high levels of an inaccurate understanding of their prognosis. And as a result, one would suspect that their conversations with their caregiver were probably on a more superficial level and that they remained in denial and that their caregiver couldn't really process the situation with them or share their feelings or thoughts about it and offer support in that way. Research suggests that both patients and their caregivers desire an honest prognostic disclosure from their provider. And these findings from this study further support the need for full and accurate and open prognostic understanding among patients with incurable cancer. Now, this is a study that was focused on the situation of incurable cancer and the family caregiver, but I just find it so encouraging that there are specific situations being looked at that go way beyond the information that we've had in the past and really enlighten us as to what we can do to make things better for caregivers and their loved one. This research really highlights the need to have interventions also that target both the caregivers and the patient they care for. And I love that it is evaluating root causes for the distress and the associations with it that have not really been evaluated before. So I know that I've taken you much deeper into the science and new research than podcasts for caregivers usually go to. But I just believe that you deserve to have accurate knowledge that goes beyond what a bullet list generated by artificial intelligence would give you. You deserve to have knowledge about the journey you're on that is factual and research-based, and so that you can make your journey as safe and rewarding for you as possible. And I just want to share my joy that new research is guiding treatment and giving a fuller awareness of the rigors of caregiving and how we can intervene to give caregivers effective help and support and understanding. And as we do that, I think the stigma will lessen and people will be more open about what they need help with and more willing to go for help. So the take-home lesson is that anxiety is treatable, but left untreated, it can cause you not only emotional pain and more inefficiency in how you're able to provide care, but also it can cause medical complications. So observe yourself and monitor your level of anxiety. And once you think you've crossed the line into an unhealthy level of anxiety, it's important to practice the self-help strategies, get checked to determine whether you have anxiety or another medical condition that's the root cause of your symptoms, and consider working in therapy or coaching and possibly getting help from medications. Your mental and your physical health are linked, and both are important. And despite the chronic demands and stress of caregiving, which puts caregivers at risk for anxiety, there are self-help strategies and professional treatments which can give relief. You matter, and your health matters. Get help if you need it. Don't let embarrassment, shame, or stigma hold you back from caring for yourself and having your best possible health. You deserve health. You deserve care. And the healthier you are, the better you will be able to love and care for your relative or your friend that you're caring for. I hope this information improves your life or the life of someone you know. And if this episode is useful to you, please like, follow, and share it with a caregiver that you know. If you'd like to work with me personally, you can contact me at cba@scissortailhealthcoaching.com. Also, I would love to hear from you about topics you would like covered in a future episode, or answer any questions you might have. Until next time, take care. This is Dr. Corabelle Arps for the Caregivers Care Port.